Hello?
Hello, Mrs. Patterson. This is Dr. Smith. I was returning your call about your mammogram results. Is now a good time to speak?
Yeah, I'm here. Can we talk about what's going on with that result?
Yes, absolutely. Let me first ask, what was your understanding from the message you got about your results?
Honestly, it sounded like they found something suspicious, but I didn't get why a biopsy is needed right away.
Yeah, absolutely. So what it means is that on the image, they did see an area of the image that they can't quite tell what is there. And so
So they're not.
I'm sorry, go ahead.
Wait, so they're not sure what it is. Is that what you're saying?
That's exactly it. That doesn't mean that it's cancer, but they just want to take a closer look and better understand what it is.
Okay, but can you tell me why just another scan wouldn't be enough to figure that out?
Yes, absolutely. So we are recommending that you schedule biopsy, which means they will go in with a tiny needle and take a small portion of what they're seeing out. And that will give them something physical to look at to better determine, more than an image, what is actually there.
I get that, but it still sounds a bit scary. How urgent is this really?
I understand, Mrs. Patterson. Your feelings are perfectly normal. It is urgent, however, because we really want to know what is there. The sooner we find out, the better to know if we need to take further steps.
All right, I hear you, but I need to understand, what exactly did they see that makes this so urgent?
It just means that on the image, there was a portion of the image that was a little bit shaded, meaning they found a mass that could be nothing, but we need to take a closer look to understand what it actually is.
So you're saying there's a mass, but we don't know if it's something or nothing until we do this biopsy, right?
That's exactly it.
Okay, I'm starting to get it now. So what happens during the biopsy? Is it painful?
So what happens, and your feelings are, again, perfectly understandable, is that they numb the area and they do insert a small needle in to take a sample. So I don't want to say there's not going to be any discomfort, but they will do the best to numb the area so you feel as little as possible.
All right, I can handle some discomfort if it means we get real answers.
Yes, we will absolutely get real answers.
All right, I guess I'm ready to set it up then.
Okay, so for the next steps, there should have been a phone number that was included in the message for you to call. The next steps would be to call and schedule that, and they should be able to get you in right away. If you have any problems calling or there's anything that's confusing, please reach out to me in my office and we will try to assist as best as possible.
All right, I'll give them a call and get it set up. Thank you, doctor.
Thank you, Mrs. Patterson.